Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path. Hello everybody. Today we are welcoming one more time Dr. Physiotherapist Nav Grewal. Hi Nav, how are you?
I'm doing great, thank you. How have you been?
Yes, all is great here in Toronto. Today is February 27th of 2020, so we are almost ending another month of 2020 so fast. And I am surprised that this winter hasn't been that bad, actually. Today it was a snow day, but not that bad. And I'm enjoying the contrast between the heat of Miami and LA and the cold of Toronto. We have to embrace it and we have to adapt ourselves. And in this topic today that we have been talking about the spine health for the past 3 months, in this topic today we are dedicating it to the sacroiliac joint, which is the one that attaches in our pelvic floor, and it's a very important joint that a lot of things happening. And actually, because I was talking to you about the snow, we have to be very careful of how we are walking on those slippery floors. And the SI joint is one of the ones that can get affected if you ever sleep on the floor, if you get into a car accident, and even if you are actually pregnant. So Nav, this topic, like we actually talked a little bit last time when we were chatting about our last topic related to sciatica, and today we will be sharing more information deep down into this. So tell us about the SI joint.
Right, so the SI joint is basically, so if you think about the spine going down, a lot of people think about the kind of like the low back. Right below that, the spine keeps going into the sacral area and then the tailbone. But right beside, if we think about the hip crest, they come from the front all the way to the back. And the easiest way to think about it is if someone is feeling in their back and they kind of feel like that little divot, kind of like pointing out on either side, that's where that joint is. They're on both sides, they're big joints, and they are there to help support the upper body joining into the lower body. Very, very important area. A lot of muscles, ligaments, nerves pass in that area. And they're stable, and they're there for stability and providing support when we're moving around or sitting, even postural.
So in this area that actually doesn't move much, right? It's more like a posterior and anterior.
Right, so the joint, like, there's been a lot of debate about this, as I was saying, we were chatting a little bit before, but there's a lot of stability in the area, and because there's so many ligaments attaching the bones together, they actually don't really move that much, whereas before it used to be thought of as, well, you know, the joint is out of place, it needs to be cracked, or it needs to be put into place. Of course, that would be the issue if someone had a very traumatic injury. I've fallen down the stairs in grade 8, like all the way down the stairs and leading to the basement at my home, and so I had a SIJ injury and was referred by the doctor to a physiotherapist. And again, it was, you know, exercises we did not involve manipulation, and yet I got better. So that just goes to show you that that joint is actually very, very stable.
Yes, it is. Now, because I actually met you in Toronto Yoga Mamas, you work there as the physiotherapist specialist in the pelvic floor. So this is something that you probably get a lot of cases of mothers with a childbirth and all these changes that happens with our hormones, that we become very flexible, expands this area, and it can create some imbalances. Could you tell us some stories or what's happening exactly with the pelvic floor and pregnancy?
Totally. So this area, the hip muscles are attaching here, pelvic muscles are attaching here. We're going from the upper to the lower body. So generally what's happening during pregnancy, yes, relaxin is a hormone that is released. So a lot of the ligaments are, loosening up, but also the woman's posture is changing. So she's going from, oftentimes being straight, but now the weight of the baby, she's going like this, and that's a lot of pressure on the SI joint as well as the low spine. And that can create imbalances because some muscles will be shortened, other muscles will be lengthened, and then certain muscles, because they're shortened, they're not as active, or they're maybe overactive, and that can lead to pain in certain areas. So including the low back, we also see a lot of sacroiliac joint pain with women coming in, and they're feeling it pretty intensely and they just want it to go away. So, but it can be treated very, very simply, and oftentimes it's kind of pressure on the joint, but it's really the muscles supporting that we can kind of accommodate and work on so that there's less pressure on the joints.
Okay, yeah, that's something that all the women that are listening to this podcast are aware of that. And something that we always remind to all our listeners is that the best to address any of these issues is to first go to a physician. The physician normally he does a set of movements and exercises to see what's happening, and if it's very severe, they will send you to most likely a specialist, either a sport physiotherapist or somebody like that. So we just want to make it sure that this is a information that we're providing it from a very professional way, from a physiotherapist, but we are not giving you the advice to do this or not, because at the end you have to go to your physician and he's the one that's going to tell you what to do. If you want to actually find Nav Grewal, she's in Toronto Yoga Mamas, and that she can be found in the whole GTA of the city. So now we wanted to talk a little bit of the treatments once you are diagnosed with any sacroiliac dysfunction. What are the treatments once you know what you have something related to this area?
Yeah, so one of the things that we're assessing for is what the muscles are doing. So if the muscles are very, very tense, then I am getting my patients to do a lot of stretching, belly breathing, relaxing their pelvic floor, relaxing the back glute muscles. Along with that, on the other hand, we find, the muscles are doing okay, but it's actually a strength issue, then we would be doing strengthening. Usually, though, it's a combination. Like with anything, we're doing a combination of stretching and strengthening, and more so kind of empowering the woman to give her some exercises so that she can do these exercises at home, especially when she's feeling that pain, so that I can relieve it immediately for her. As well, along with that, sometimes I might, say, do these stretches or use ice, heat on the low back, whichever is feeling better to help alleviate the pain. But generally, it's stretching and strengthening exercises, just like you would do as well with your clients, like a combination of both to see which one suits them best. Yeah.
So in my Pilates classes, many people come with this issue, particularly in this region. And I have actually one client in this moment that has a bursitis in the sacroiliac. What do you think? Is this bursitis related? I mean, bursitis can be like a consequence of dysfunction?
Yeah, I've seen patients with that bursitis and also greater trochanter bursitis, which is kind of like hip bursitis. Usually, so the bursa is just there. It's just sitting there. So for everyone watching, they're like, what is bursitis? So a bursa is a fluid-filled sac that is providing cushioning in between bone and muscle, and so we have them everywhere. Particularly the one in the hip tends to get inflamed. The SI joint one might also get inflamed, but the actual bursa is not the cause. It's just there. That's the kind of the consequence. And so the muscle usually is the thing that we're looking at, because we're like, okay, what is the muscle doing that's causing that friction on the bursa? Most of the time. Rarely is the actual bursa the issue.
Okay. So this could be one of the consequences related to that.
Yes, exactly.
Have you heard about the fat wallet syndrome?
Right. Yeah. Yeah. Guys sitting on their wallets, which I don't know why you would do. That's not comfortable.
Yes.
Yeah, but you were mentioning how, you've seen it, right? But yeah, that would just, if someone's sitting on their wallet, and depending on how thick their
Well,
wallet
hopefully
is,
it's
right?
money, right?
It's funny. Yeah.
Hopefully full of a pack of money. That would be nice. Where are these guys in the city? I want to see the full amount of money. No, like I remember my dad used to walk with a wallet really thick with so much like business cards back in the day. We're talking about like 30 years ago, and we didn't have iPhones that can have all this storage of everything. So probably that's more of a very old syndrome that's not happening now, because most of the people are so simplist in this moment. They're keeping like the simplicity of just having everything on the phone. But I think back in the day it used to be a syndrome with people wearing thick wallets, and by the time you sit with the wallet it lifts your hips and it creates an imbalance, and actually was called the fat wallet syndrome. And the other way to get the SI joint imbalance is for those people that are sitting with one leg on top, and it kind of creates a lift on a hip and it's not like completely stable. That could create also an imbalance, I believe. And in my case, I am left-handed, but when I'm standing, I tend to lean into one side, which it could be related to my scoliosis. So I don't stand consciously with my 2 feet on the floor. I usually bring my hips to one side. So those type of things can affect. And I think another thing that can affect the SI joint is when one of the legs is longer than the other, right?
Yeah, totally. Yeah. So those are all kind of like structural things for sure that would affect, because it has to affect something, and like it's like really applying pressure again at that area where it connects the upper body to the lower body. Like that is the space that's connecting it, and so any tilting this way or this way for sure it's gonna affect it.
So, like another question that I had from the viewers is, how can we test the length of our legs?
That's a pretty, like, I mean, it's very hard to do for yourself.
No, like with a doctor. Like, which doctor will do this?
Any doctor.
Yeah.
Any doctor can do this. Yeah, and like I've done it before as well. You just have certain landmarks that you're looking for, and you're measuring on each side. It is a subjective test, which means that like I'm not taking like a tape measure and measuring it out, but I'm landmarking the hip crest. I'm landmarking the kind of like the hip joints, the greater trochanter, patella, and then ankle, and yeah, like you can literally you can tell pretty easily. So just by looking and kind of like gently pulling on each side to see what's going on. So it's a very easy test. You don't really need to go to a specialist doctor for that.
Okay. So that will be a good idea. If you notice that you have a little bit of an imbalance in the legs, maybe you could go to your physician and check the length of your legs. That could be something that could affect you, and then you maybe have to change your shoe size and all that. So yeah, there are things that sometimes we don't know and we're not aware. And to kind of close the topic, we wanted to go through the whole method of how to rebalance and to go through a treatment for the SI joint that you were telling me just before. Could you tell us about this method?
Sure. So a physiotherapist, Cecile Ross, she works in, I don't know if she's retired now, but she used to work in Montreal, and she was seeing a lot of women during pregnancy who were coming in with SIJ dysfunction and pain, and so she created, and she noticed that certain exercises she was giving them was providing them with relief, so she came up with a method called the Ross Symmetry protocol that's now very widely used.
How do you spell the last name?
Sorry?
How do you spell the last name?
Rost, R-O-S-T.
Okay.
So, yeah, very easy. And symmetry protocol, and it involves 2 exercises done. It's like a few minutes. They're pretty gentle exercises so that women during pregnancy can do them. And I've used this a lot with my patients, and it's seemed to provide a lot of relief, and so I'm a big proponent of it, and it doesn't require a lot of quick equipment or time or anything like that. Yeah.
Okay. So it will be very nice if you want to know more about this topic to visit Dr. Nav Grewal, so she personally will teach you how to do them. I particularly don't want to teach it because I'm not certified or I haven't been trained by anybody to be able to train somebody with this. But I hear it's great. It's not that difficult. You just need a fair supervision, and then you just repeat it. And it doesn't take you more than 10 to 15 minutes to practice this daily. And it's a great method that has been proved that effectively can help you with this issue. So this is how we wanted to just finish the topic of the sacroiliac joint for today.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.